Hello, my name is Nicholas Cohen. I'm very excited to present to you on the AmeriCorps Super Coach program, which is a tobacco cessation initiative at university hospitals. This is our presentation to primary care practices. Our objectives are that you understand the importance of addressing tobacco use, describe the Super Coach program, and see how to work with a Super Coach. The problem this program is meant to address is tobacco use. Tobacco use is the leading cause of preventable disease and death in the U.S. and, in fact, in the world. In Ohio, and especially Cleveland, rates of tobacco use are significantly higher than the national average. And these rates of tobacco use have been attributed to our poor health rankings in comparison to other states. We rank 46th in national health rankings and 43rd just for tobacco use. You can see the rates in Cleveland compared to the United States, significantly higher by about 30%. And the rates in Cleveland compared to the United States, tobacco use is more than double the national average. The good news is that smokers do want to quit. Nearly 7 in 10 smokers report wanting to quit. And thanks to the Affordable Care Act, pharmacotherapy and counseling is covered by Medicaid insurance. The challenge we face, however, is that rates of delivery of counseling and pharmacotherapy are low. In Ohio, for example, only 2% of adults with Medicaid receive counseling for tobacco use, and only 5% receive medication. The reason for this? In a report by the Department of Health and Human Services, providers cite time constraints as the major barrier to delivering these interventions. So what can we do about it? Well, at university hospitals, we have the AmeriCorps Super Coach program. These are national service members who sign up for a year of service. It's like the Peace Corps in the United States. The value they bring is they're unbound by time constraints that affect clinical teams across the system. They're highly trained in motivational interviewing and in counseling for tobacco use, and they are passionate about making a difference. Providers offer every smoker they see brief advice to quit, pharmacotherapy options, as well as referral to a coach. Providers can bill for the time they spend with the patient using 99406 billing code, and coaches conduct a virtual visit via iPad at the site of care where the patient's being seen. They can also provide follow-up by phone with the patient after that initial interview. And our outcomes are extraordinary. Providers are 10 times more likely to address tobacco use when a coach is available. Providers using a coach are billing up to $10,000 per year for their counseling. And quit rates at 6 months are 30%. And this is compared to the average in the literature for motivational interviewing for tobacco cessation, which is around 24%. So how do you place a referral? Well, you'll have an iPad or other device in your clinic, and you'll have Cisco Jabber installed. You'll have a list of the coaches who are available, and you'll text them, are you available? If they are available, they'll let you know, and then you will text them back to call for patient so-and-so. They'll have access to the EMR. They'll be able to identify the patient based on their last name, look up their MRN and their first name. When no coach is available, then you can email supercoach@uhhospitals.org, including the patient name and their medical record number, and a coach will contact them by phone. Next, I'll bring up one of our service members who will describe what happens in the room.
Hi, so I want to give a brief description of what I do when I enter the room. The first thing I do is ask permission to talk about their tobacco use. It allows the patient to understand that they're in control of the conversation, and anything that they're comfortable with sharing, I'll be listening for. We then go through their day-to-day routine, about their tobacco use, if they wake up in the morning and smoke, and how many they're smoking and how often. After that, I ask them 2 scaled questions on a scale from 1 to 10, what's their importance of quitting, and then also on a scale from 1 to 10, what's their confidence in quitting. From that information, we usually come up with a plan on how to prepare them to quit smoking or how to decrease their tobacco use, and we come up with plans, alternative things they can do to distract themselves from that. I also describe their nicotine replacement treatment that's been prescribed to them. And finally, we come up with a quit date. That quit date allows them to prepare and set an absolute date in which they're going to quit tobacco use. And the most important thing I do is the follow-up call. So post meeting them in the clinic, I'll give them a follow-up call whenever they want. They kind of have control of that. And it really allows them to have a support system inside and outside the hospital.
In this video, you'll get an overview of how to document and bill for tobacco cessation and treatment to meet meaningful use and improve billing revenue for your practice. First thing you do is you go to social history and you make sure that tobacco use has been assessed. If the person is a smoker, you click on the pad icon. And you then click on the care guide. Here you will provide the patient with educational materials, which counts towards meaningful use. This will get printed with their clinical summary. And you can also order your nicotine replacement products from this window. Then you click OK. Under Orders, you will go to Procedures and click on the amount of time you spent and whether their presenting condition was related to their tobacco use. And then when you are submitting your charges for the visit, you go to MD Charges, just like you would normally. For visit charges, in addition to their billing code for the visit, you're going to select this top tobacco cessation option, and this is code 99406. You're going to also select the modifier group 25, which is not available in this test record. In summary, the AmeriCorps SuperCoach program makes addressing tobacco use fit into the time-constrained outpatient visit. Brief provider advice and pharmacotherapy are important components for the program's success. You can use Cisco Jabber or email us to place a referral. Our quit rates are 30% at 6 months, exceeding the average for motivational interviewing in the literature. And documentation and billing allow us to meet meaningful use requirements and increase revenue for your practice. If you have any questions, please email us at supercoach@uhhospitals.org. Thank you.